Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. We're so excited to get into what we have for you today. I'm Jennifer Edwards-Johnson, and I'll be bringing you this host of welcomed expertise that we have today. There's a couple people not on this PowerPoint. We've got Dr. Omari Young, who's going to talk to us a little bit about cancer in women and gynecological cancers and screening and prevention. We've got Dr. Lee Pierce, who's going to talk to us a little bit about her program, MiCHWA. We've got Lottie Ferguson, our Chief Resilience Officer. We've got some people from the City of Flint who are going to talk to us, and we've got Diane Russell with us. So lots of expertise, lots of resources, and we're really excited to chat with you all today. We're going to start by talking to Dr. Young a little bit about cancers in women and what cancers we should be thoughtful about and what screening and prevention looks like, and also a little bit about like what cancer is and what we need to be thinking about when we think of cancer.
Thank you very much. Again, I'm Dr. Young. I'm OB/GYN here at Hurley Medical Center. It's definitely an important topic. I'm glad to be a part of this weekly event again. Given that we're on the heels of finishing up Cervical Cancer Awareness Month, I think it's important that we can give a kind of brief overview of gynecological, or we call reproductive cancers as a whole. These are cancers that affect the reproductive organs of women, and then also in its own separate category is breast cancer. With regards to reproductive cancers, we have uterine cancer, which affects the uterus, ovarian cancer, cervix, and then vaginal or vulvar cancers. The most common reproductive cancer is uterine cancer, and part of that is because of the risk factors related to it. So the most common type of uterine cancer is called type 1 endometrial cancer, and that's thought to be related to large exposure to estrogen. And the way we've seen that increase in exposure to estrogen, which is a female sex hormone, is because of our obesity epidemic. So over the last 10 to 20 years, obviously, we've seen an increase in the obesity population within the United States, and it's been a direct correlation in the increased incidence of uterine cancer. So that's why it's been replaced cervical cancer as the most common reproductive or gynecologic cancer. Conversely, the rates of cervical cancer have decreased because, again, as I talked about in our previous session, we have great screening for cervical cancer with the pap smear and also the primary prevention with the HPV vaccine, because we know that with cervical cancer, the underlying cause is the human papillomavirus. So getting our young children, boys and girls, appropriately vaccinated with the HPV vaccine series is so important. But in general, when we think of cancer, whether it's reproductive cancers or cancers of different organs of the body, when we talk about risk factors, we think about risk factors as what we call modifiable and non-modifiable risk factors. Things that are non-modifiable that we really can't change is that's just the kind of cards we are dealt with is age. We know uniformly that age is one of the most common underlying causes for increased risk of cancer throughout all the different spectrums of cancer, including reproductive cancers. And then also outside of that, your family history. So if you have family history significant for breast cancer, uterine cancer, cervical cancer, so understanding your own family history is so important when thinking about your risk for cancer. And then when we talk about modifiable risk factors, the main thing is drug exposures and lifestyle. So we always know about the commercials that talk about cigarette smoking in relation to lung cancer, but we know that cigarette smoking and other substance use increases your risk for all types of cancers, including breast and gynecologic or reproductive cancers. Weight loss, so having an appropriate healthy lifestyle is also so important. Those things that you can readily modify to decrease your risk of developing certain types of reproductive or gynecologic cancers. And then also, there are other modifiable risk factors that we recently learned too especially with regards to ovarian cancer and breast cancer. So with ovarian cancer and breast cancer, we have recently known that when you get what we call risk reducing, what we call bilateral tubal ligation, or what we call self-injectomy, that actually decreases your risk of getting ovarian cancer later on in life. It's not a prevention, but it reduces your risk. So what we call, anytime a woman is getting their tubes tied when they're completed childbearing, in the past, most people think of it just a nip and cut. But now we know that removing the actual whole fallopian tube reduces women's lifetime risk of developing ovarian cancer later on in life. And then also at the time of hysterectomy, is so important to remove the fallopian tubes. With regards to breast cancer and reducing your risk later in life, we know that within the news, we heard about Angelina Jolie and other celebrities who had risk reducing mastectomies, or they had hysterectomies, or had their ovaries removed early in life. That's again one of those family history and non-modifiable risk factors, and that's regarding to the BRCA1 and 2. So if you again look at your family history and see that a lot of women in your family have developed reproductive cancers at an earlier age in life, it's so important to get genetic counseling and get screening for BRCA1 and 2, because if those are positive, at the earliest moment when you have completed childbearing, you should consider getting a risk-reducing mastectomy, or a risk-reducing removal of your ovaries, or getting a hysterectomy. So again, it's so important to do those basics. Take care of yourself with a healthy lifestyle, know your family history, get regular follow-up, and understand the appropriate screening. And again, with breast cancer, the biggest thing as far as early on screening is what we call, I think the old term was breast self-exams. Now we use the term breast self-awareness. So knowing what your normal breast anatomy looks like. So how does it feel? How does it look? Any skin color changes? Any dimpling in the skin? Any pain? Do you feel any lumps? Any nodules? So just being aware of your own breast anatomy is so helpful for your physicians, whether it's your women's health provider or your primary care doctor. So having that breast self-awareness, and then later on in life, getting the age-appropriate screening. So there's some debate on whether or not breast cancer screening should start at the age of 40, or should it start at the age of 50? And again, I think that's having a detailed conversation with your physician and knowing your family history. But if you go by the current guidelines, they say that it doesn't need to initiate until age 50. But again, having that discussion with your healthcare provider will guide your decision making. And the screening of choice is a mammogram, which is basically taking an X-ray image of your breast. Outside of breast cancer and cervical cancer, there are no reliable screening tests. So with breast cancer, we have screening with the mammogram, and cervical cancer with the pap smear, and then the primary prevention with the HPV vaccine. Outside of those two, and again, it's just getting regular follow-up, knowing your body, paying attention to those signs and symptoms. And again, a lot more times than not, a lot of them are asymptomatic. So again, that's where, again, having consistent follow-up with your provider. And then when we're talking about broadening out to healthcare disparities, we know that reproductive cancers impact minorities and African-American women a lot greater than their Caucasian counterparts. First, with breast cancer, so there are some quote unquote good types of breast cancer, and there are some more aggressive types of breast cancer. So we know there are hormones, receptors that are associated with breast cancer: estrogen, progesterone, and there's another one called HER2. If those are positive on breast cancer, that allows for targeted treatment. Whereas if you say, you probably heard the term triple negative, means that it's a more aggressive and there are less treatment options. African-American women are more likely to have triple negative breast cancer than their counterparts. And again, that's leading to that disparity in survival rates and prognosis. And then similarly with cervical cancer, African American women are dying at a higher rate and are diagnosed with a higher stage at the time of diagnosis, and including ovarian cancer. So there's a lot of work to do on our part from a public health and research perspective on evening out those outcomes for minorities and African American women.
I love that you talked about those disparities. And I know Lee is probably sitting in the background like, this is perfect. This is everything that we're doing research on with MiCHWA. So you said something and my ears immediately perked up because I understood it as a physician. I was like, yep, obesity and cancer epidemic makes total sense why those would be related, especially for gynecological cancers. Can you talk to people a little bit about what that relationship is and why those would be related?
So when you think about any life, so for instance, lifestyle and weight loss. So your diet, exposures to substances, again, they affect, not to get too scientific, but they affect how your normal cells work in your body. So when we break it down to those basics, cancer are disruptions of normal cells within your body. And when you have unhealthy lifestyle, obesity, those put a kink in those normal cells and they become cancerous cells.
Right.
And again, those are modifiable things that every woman can do as far as creating a healthier lifestyle, whether it's diet, exercise, limiting smoking, alcohol use. You're less likely to create changes within those cells, whether it be cells in your breast, cells in your uterus, cervix, and ovaries, that'll put you at increased risk of developing cancers in those organs later on in life.
And there's this element too, right, of like adipose tissue being estrogenic, right? That
exactly. So that goes back to the theory of the increased rates of cancer of the uterus or uterine cancer being associated with the obesity epidemic, because we know that adipose tissue or fat cells contain a high amount of estrogen, and having that, the way a woman's normal menstrual cycle is regulated is a balance between two hormones, estrogen and progesterone, and that delicate balance regulates your normal menstrual cycle. When the balance tips in the hands of estrogen, which the term we use, unopposed estrogen, then that puts women at increased risk of overgrowth within the uterus and increased risk of uterine cancer, what we call endometrial cancer. And that's the same thing from also thinking about substances that can increase risk for your rates of uterine cancer too, is that in the past, a lot of women were getting HRT or hormone replacement therapy to make them younger again, to treat menopause and other things, and they were getting it at high doses. They were getting high doses of estrogen to treat those symptoms when they were in menopause. But then we quickly realized with those high doses of estrogen and hormone replacement therapy, we were seeing increased rates of uterine cancer in those women. So now we've really been very selective and limited in who we give hormone replacement therapy to, and also thinking about hormones and related to breast cancer too, is being really thoughtful about giving hormone replacement therapy in certain populations, because again, we know that large amounts of hormones can put women at increased risk of certain types of breast cancer.
That's fantastic. I want to leave people with something that you talked about regarding screening. You said that breast cancer has a great screening modality and the mammograms at 50 when it's appropriate. Cervical cancer, you mentioned pap smears and the testing for HPV virus and the primary prevention with the vaccines. And so you said your breast, you said your cervical. What you mentioned other cancers though? So what do we do about ovarian and endometrial?
So, the thing is, it's monitoring for symptoms. So I talked about having self-breast awareness, just having overall awareness of your own body as a whole. So we're obviously with uterine cancer, again, as I said, the most common risk factor for all cancers are age. So for uterine cancer, average age of menopause when you stop having your cycles is around 50 to 51 in the United States. So if you're after 50, you stop having your cycles, and then all of a sudden, you're after 50, you start seeing vaginal spotting. That should be something concerning. So that's what we call post-menopausal bleeding. So bleeding after menopause, that's a concerning sign that you should get evaluated and worked up for uterine cancer. For ovarian cancer, those symptoms are a lot more subtle. And again, that's why it's one of the more common and aggressive types of cancer, because it has a higher stage usually in diagnosis, because a lot of women are asymptomatic with ovarian cancer. Because a lot of times you get those kind of constitutional symptoms, so weight loss, decreased appetite, and then also sometimes you see enlarging of your belly as the cancer grows. So a lot of times we know it until it's a later diagnosis. So again, unfortunately, we still haven't been able to find a reliable screening test for ovarian cancer. So a lot of times, unfortunately, the prognosis and survival rates are still the lowest among ovarian cancer, because at the time of diagnosis, it's at a later stage, because again, there are not reliable symptoms or reliable testing early on.
Dr. Young, we appreciate you so much. Mostly, I appreciate that every time we ask you for something, you are more than excited and willing to jump in and educate us with all of the stuff you know. He's talked so much about the importance of having a great relationship with your women's health provider so that you can ask these questions when you're unsure of the symptoms you're having and get your screening. Thank you so much for your expertise.
Thank you.
And I see you in the clinic there, so I will let you get back to your clinical work. Thank you. Dr. Pierce, I feel like this is such a good lead into the work that you're already doing, looking at screening, looking at prevention. And I see Dr. Justin there. Thank you so much for having your team here to talk about MiCHWA and the important work that you're doing. I'm going to let you describe MiCHWA, because if I describe it, I will leave something out, and the program is so unique and so valuable. So thank you so much for being here and talking about your really amazing program.
Thank you so much for having us. And I'll just share my screen with a few slides. There we go. So MiCHWA stands for the Michigan Cancer and Research on the Environment Study. And really our goal is to explore the impact of environmental justice on health, and particularly on cancer risk. And we're really grateful for our many partners in being able to do this work. So my name is Lee Pierce. I'm a cancer epidemiologist, and as chance would have it, relative to Dr. Young's talk, my area of expertise is in women's gynecologic cancers. And so I really appreciated everything that he had to say, and especially coming off January as Cervical Cancer Awareness Month. And I'm joined by my colleague, Justin Colosino, who is an environmental health expert and a toxicologist, and really just a wealth of information. I learn something new from him every day. So I really don't need to tell this audience that across Michigan, there are hotspots of environmental injustice. And you can see those areas on the map on the right, where the red orange spots are really areas that are most affected by environmental injustice when we measure environmental injustice based on environmental exposures and effects, and then also population characteristics, structural barriers to health. And you, of course, know that you are all right here in Flint. And so basically what we had heard from communities was that research needed to be done to support advocacy efforts, that we needed to include diverse community voices in research efforts, that we needed to understand how many people are sick, how many people are dying, and really more broadly to study the impact of environmental exposures on cancer risk. And this kind of Michigan environmental word map is what Michiganders have been telling us that they care about when it comes to the environment. And we just keep building this out, the more we're out in the community. And I'm sure many of the words on this map resonate with the Flint community. So what is MiCHWA? MiCHWA is what we call a prospective cohort study, meaning we're starting now and going into the future to determine what environmental exposures are associated with cancer and other health risks. We designed MiCHWA to be broad, to include as many Michiganders as possible. And so the enrollment into MiCHWA is open to anyone between the ages of 25 and 44. Why that age group? Because people in that age group, for the most part, don't have cancer now, but they are at risk. And so we like to measure exposure before someone has cancer. And that's how we know that it is associated with cancer. We really would like to have a diverse cohort. We'd like MiCHWA to be diverse, at least 75,000 Black, Latinx, and Middle Eastern, North African participants. So these groups, as you know, are often left out of research, and especially these efforts to really understand cancer risk. So what does it mean to be a part of MiCHWA? What does that commitment look like? So the first is to complete a survey, and that can be done fully remote. There is you don't have to go anywhere. You can do it on your phone, you can do it on your computer, your tablet. It takes about 10 minutes a day for 1 week. And that leads us to a lifetime of knowledge. So essentially about 70 minutes. What an individual gets, like specifically at the time of enrollment, will be a $10 gift card, as well as an option to select a local organization for us to provide a donation to that over time we hope will represent a substantial contribution. We also ask people who enroll to consider providing a blood sample and 2 saliva samples. This is collected by the participant themselves. They don't have to go anywhere. We mail a kit and then we come by and pick it up. And then we also are asking people who enroll what additional research questions matter to you. We're also doing focus groups to understand that. And so in the future, we already ask about water-based exposures, but we're going to do a deeper look at that, understanding your exposure through showering and so on. And then we also want to understand more what's happening in people who are pregnant, because we know that there are changes in the body that can make us more susceptible to exposures during pregnancy. And this kind of information would be provided at annual follow-up questionnaires that would each take about 10 minutes to complete. So what are we asking about now when you first enroll? We're asking about where you've lived, a little bit about your background, your race, ethnicity, questions like that, chemical exposures, both inside the house, in your hobbies, around the yard, your personal product use. What kind of shampoo do you use? What kind of deodorant do you use? And I'll just talk a little bit more about that in a few minutes. Personal health and wellness, as well as lifestyle, which are some of the things that Dr. Young just spoke about as being associated with cancer. From communities, we will gather information that is available through monitoring and Google Earth and things like that. So heavy metals, air quality, how much green space is in a community, what's the noise level, what's the PFAS exposure level, and how walkable are neighborhoods, as examples. So we won't ask you about this because we're asking you about where you've lived, so that we can build out a complete profile of your exposures over time, starting from when you were born. So we are asking where you've lived across your lifetime. because we want to understand the full scope of what every MiCHWA participant has been exposed to. So what are we doing with the blood and saliva samples? So we're going to be measuring stress and inflammation markers like cortisol. We're going to be measuring heavy metals like lead and cadmium. We're going to be looking at immune function. How well is your immune system working? We aren't going to be measuring this on everyone right away, but we will be doing it on a subset at the start and then building out and doing it on more people. And as we do that, we're currently working on a way to give the results of these tests back to participants so that you know what your profile looks like. All right, so what are our goals? We want to understand the impact of toxic environmental exposures and pollutants on health, primarily cancer, but other health risks too. We want to work with you, the community, to understand and answer your questions. We want to tell you about environmental exposures and findings, what we discover, and then we really want to use what we find, the scientific evidence, to force policy change. And we're already doing some work on that, which I'll talk about in a minute. So what will we do? We will protect your privacy. We will never release individual data about you. That stays with us. We have very carefully linked databases so that your biologic specimen is not linked to your name and so on. We're monitoring what's happening in the environment in Michigan and in the research literature that comes out. So what does that look like? Well, just as Dr. Young told us that uterine cancer is the most common gynecologic cancer, there is a very important paper that came out recently that talked about use of hair straighteners, relaxers, or pressing products being associated with increased risk of uterine cancer. And so our team has put together what we call here a visual abstract to distill down for the community what was found, what it means, and what you can do. And so, as he said, as Dr. Young said, it's the most common gynecologic cancer. In this graph up here, you see these are how much uterine cancer is occurring in the US over time, and you can see it's going up. And this top line is Black women in the US, and you can see that the risk is higher in Black women overall. Women who use these straightening products had use these products at least 4 times per year compared to not using them, had 125% increased risk of uterine cancer. Why? Well, we think it's because some hair products contain cancer-causing chemicals. What can be done? Consider using paraben-free, phthalate-free, formaldehyde-free products, for example. All right, we also are conducting webinars and town halls with environment and cancer experts. What does that look like? Well, you may have seen in the news that there are microplastics floating around in our bodies. Why? And what can you do about it? What does that mean? Colon cancer is increasing in younger people, like Chadwick Boseman, who unfortunately died recently. Why is that happening? What can you do about it? And so on. So we have a whole series of what we're calling mini webinars, 15 minutes of information and then 30 minutes of Q&A. So somebody can just pop in for 15 minutes if that's all they have, or they can watch it after the fact, just to get a little bit of information out about a lot of relevant current topics. All right, we are also participating in health fairs. We're also discussing cancer prevention. So for example, we were at the Flint Farmers Market last weekend. We had, because it was Cervical Cancer Awareness Month, information about screening, how people could determine whether or not they should be screening right now, as well as asking people about their environmental concerns, and inviting people to participate as well. All right, and then we also want to hear from you about what you would like us to do. What can we bring to the table? We're super excited about that. And then just briefly, we also have 2 major immediate actions that we are working on as part of the Flint Community Cancer Consortium, which I think is going to be discussed in more detail at a later meeting. But this is also based on what we've been hearing from the community, and that is evaluating whether or not there is unusual cancer occurrence in the Flint area. This is something we have heard loud and clear, and we are there to support this work. And then the other is to really start pressing for a discussion around the cumulative impact of industrial pollution. So what happens right now, if you look at the picture on the right, you have smokestacks, you have trains. In this particular area, the noise is crazy. And the way environmental law works is it's not currently looking at the total impact of all of these different industrial polluters, but looking individually. But really, it's the cumulative impact that matters. And we are taking steps in hopes of making sure that the cumulative impact is taken into consideration. All right, what can you do? We'd love for you to enroll in MiCHWA. It's michws.health. We'd love for you to encourage your family and friends to enroll, and then we would also love for you to follow us on social media. And with that, I will wrap up. Happy to take any questions, and thanks very much for your time.
Thank you so much for all of this wonderful information and all of the wonderful work that MiCHWA is doing. And I appreciated that you mentioned, you know, our sort of partnership, right? There are not many times when Michigan and Michigan State and other entities get together and agree on something, but FC3 has agreed that thinking about cancer incidence and what that looks like in Flint and what types of resources we can bring to Flint is so worthy and so important. And it really highlights the goal of this webinar, right? Arthur, part of how FC3 developed is through a community member talking about their concerns in the community and talking about what they were seeing in the community. And I say that to encourage everyone on the webinar. If there are things you're seeing, things you want us to talk about, things you're hearing, we want to hear from you. We're able to get wonderful people like Dr. Pierce and Dr. Justin here to talk to us about their expertise and bring sort of what they've been able to do and their sort of academic mindset to these really important problems. So super thanks. Any last comments, questions? I want to make sure I don't see anything else in the chat. No. Well, that was phenomenal. Thank you so much to both of you. We really appreciate it.
Thank you.
All right. I see Lottie Ferguson and I see Faith. We've got a couple people from the city and I want to give them an opportunity to share their expertise. Thank you so much. Oh, there you are. Thank you, Lottie, for being here today. Uh-oh, do we hear you? Okay, perfect.
I am going to share my screen here.
Fantastic.
Let's see here. Of course, the phone is ringing and everything's happening at the same time.
Oh, no worries. And Lottie, I think I have your title right. Chief Resilience Officer with the City of Flint.
You do.
Fantastic.
Yeah, I'm not exactly sure why this is not working right now, but I will keep going because all of the information that I'm going to share with you is also available online. I'm here today to talk to you about the City of Flint's American Rescue Plan dollars that are available to the community. The application was opened last Monday, January 23rd, and the application deadline is March 27th, 2023. And you can go to grants www.cityofflint.com in order to review the application and find all of the information that I'm going to share with you today, and also to apply. Just a brief grant overview. We know that there are just over $15 million available in the community grants in 3 different areas: public health, housing and blight elimination, and economic development. I was asked today to talk specifically about the things that are in the, I'll put it in air quotes, the public health bucket, but we do know that economic development and housing and blight all are contributors to overall public health. The first one is healthcare equity, access, and research. There's $2 million in funding available with a maximum award amount per organization of $1 million. Who's eligible to apply? Healthcare providers, nonprofit organizations, academic institutions that are located in and primarily serve the Flint population. What we're looking for here are programs that will improve healthcare access and equity and support research within organizations that serve people who have been infected with COVID-19, have been caregivers, or someone who was infected and they're experiencing post-COVID symptoms or syndrome, long haul COVID. So this funding is going to take an equity approach by looking at populations that were disproportionately impacted by COVID-19, particularly low income and BIPOC communities, and ensure that organizations serving them have adequate support to meet their ever-changing needs. This is especially true with long COVID, as we're only just beginning to understand its impact on individuals, families, the workforce, and society. So this funding should both support the patients and the caregivers, as well as individuals and systems that contribute to a web of care. Outcomes of this funding should be shareable, scalable, replicable, and have value beyond this opportunity. The second one is increase to food access. There's $1 million in funding available for that. The maximum award amount is $250,000. Who's eligible to apply? It is open to nonprofits and established community-based organizations located in and serving the Flint community. So this opportunity will address the lack of access to fresh, healthy food in currently underserved areas of the city of Flint by providing community organizations that have experienced decreased funding, participation, and other barriers due to the COVID-19 pandemic. Examples can include providing incentives, policy changes, and policy changes, and development of grocery store and additional farmers markets. This funding is to improve access to healthy food for Flint residents, with a focus on communities who have faced historical and present day racism and disinvestment. Increasing access should lead to environments where healthy choices are the easiest choices to make. Individual health outcomes include higher nutrients and lower processed food intake, including less saturated and trans fat and fewer overall calories, lowering the risk of obesity and development of chronic diseases. We've talked a lot about that today already. At the community level, life expectancies should increase and racial equity and health outcomes could improve. The next one is for mental health services and support. There is $1 million in funding available with a maximum award amount of $250,000. Who's eligible for that one? It's open to any entity that has provided mental health services to the Flint community for at least 5 years and has mental health clinicians on staff. We want this one especially due to the high need in Flint to be established programs. This funding allows organizations to look closely at their own services and identify where they can increase capacity, best meet the needs of a population diverse in race, ability, gender identity, sexual orientation, political affiliation, religion, income, nationality, veteran status, language, and more. This funding will also improve equity by serving the unique needs of individuals with intersecting identities. If successful, the needs of the people who face the most barriers to services can enjoy the highest quality care and treatment. Ultimately, city and county level data would show improvements in self-reported well-being, and organizations would report higher utilization, improved treatment outcomes, and greater satisfaction with care. They should also provide services and support to address mental health concerns that were exacerbated by COVID-19 pandemic, among city residents and workers through increased capacity, accessibility, acceptability, inclusion, and cultural competency. So as you prepare to apply, there are a number of documents that are required. We understand that these are federal funds, and there are certain criteria, certain requirements that go along with that. So we'll need everybody to have a Michigan Department of Licensing and Regulatory Affairs business filing, a certificate of good standing. A copy of your certificate of good standing can be obtained from the Michigan Department of Licensing and Regulatory Affairs corporate filing website. You'll need your IRS exemption determination letter for the nonprofits only. And you'll need to supply your most recent federal tax return, all schedules as filed with the IRS, including proof of filing. We need your most recent audit, certified financial statements. We'll need your organizational budget, government photo ID for the person who is responsible for banking for the organization, your federal tax ID number, your EIN, signed and completed W-9 that would be required for payment, your federal unique identity identifier, UEI, that's from sam.gov. And for those of you who had DUNS numbers before, as this replaces your DUNS number, is not required to apply for the grant. However, it is required to receive payment. So that gives you a bit more time if you don't already have access to that. And then optional, any other documentation or relevant documents regarding your project or program will be uploaded to the site. So, you know, we understand that there are lots of organizations that may not have some of this documentation. And so we encourage you to seek a fiscal sponsorship with another organization in the community that may be established. We don't want to leave out smaller community organizations simply because they've not had any experience with applying for and using federal funds. So if you need a fiscal sponsorship or a fiduciary, they can use a fiscal sponsor to apply. The goals of that fiscal sponsor should align with the nonprofit partner. So for example, if you are a small grassroots organization that is serving children and families, you want to partner with someone who is doing similar work. And there is a sample fiscal sponsorship agreement available on the ARPA application and on the website. And an important note is that we do have 5 technical assistance providers that are willing to hold your hand and walk you through this application process if that's the kind of assistance that you need. If you go to cityofflint.com/ARPA and scroll down to the bottom, they are listed there. They are also listed in the support section on grants.cityofflint.com. Those technical assistance providers are Flint Innovative Solutions, Neighborhood Engagement Hub, North Flint Neighborhood Action Council, the Power Initiative, and Social Impact Philanthropy and Investment, also commonly known as SIPI. If you have any questions at all, we've got a few people that are monitoring the ARPA@cityofflint.com email address. That's ARPA@cityofflint.com. And for the most up-to-date information, you can visit us at www.cityofflint.com/ARPA. And if someone hasn't already put those in the chat, I will do so.
Heatherland's all over it.
That was a lot of information in just a little bit of time, but I do want people to know that everything that I've mentioned is on the website. It's on the application. There are lots of resources available for folks who need assistance or who have questions on this process.
Thank you so much, Lottie. And I saw Faith, and I want to give her a chance to join the conversation and add any additional context that she thinks we might have missed. Hey, Faith.
Well, hi. I don't have anything to add. Lottie was very thorough. So thank you so much, Lottie, for sharing that information.
Yeah. Thank you so much. This is a wealth of resources for community members who are thinking about some of these disparities, thinking about some of these problems and how they can partner with community or other organizations, academic or otherwise, to create solutions. And certainly having that technical assistance, that support to be thoughtful about their application and that context for what people need is really, really helpful. So we appreciate your support and guidance.
I do want to add one more thing that I forgot
Absolutely.
to mention. There's been a bit of confusion around whether or not individuals are able to apply. And so I want to make sure that people understand that this part of the process is not for individuals to apply. It is for community organizations that will be able to provide direct services to residents. We are unable to provide direct payments to Flint residents through this process.
Thank you for that point of clarification. That's really helpful. And Faith, I know you were going to talk a little bit about water resources that are available. And if you have a couple minutes to just share your thoughts there.
Sure. And there's a little bit of tie-in because if somebody is looking for resources, the Office of Public Health at the City of Flint is always available to help. So if somebody is looking for something specific, it doesn't mean that the resource exists, but if it does, we will try to find it. And when the money is available through community organizations, we will let people know. So if they keep checking in with us, we will give them the most up-to-date information that we have. So I wanted to share today some information about our water resources. So we have pure water filter systems and refills available at the front desk of City Hall. For those who lack transportation or have other barriers to getting here on site, we will deliver the filters to them. They can call 810-410-2020 and arrange for a delivery. We've been doing deliveries twice a week. Also, as the lead service line replacement program comes to an end, there are still some houses out there who have not had their lines replaced. In an effort to reach our residents who do not speak English as their first language, we have had the consent form translated into Spanish and Arabic. So if anyone has any friends, neighbors, or anyone they come into contact with that could be helped by having the consent form in their native language, please let us know. We will get that to them. Finally, the Office of Public Health recently published its own webpage on the City of Flint website. There are many resources on there, including a contact form that people can fill out and ask for help. And a public health navigator will reach out to you and help with your whatever it is that you're looking for.
Thank you so much. Those are amazing resources. Thank you so much to the City of Flint and Faith and Lottie, your expertise in helping our community think about how to solve some of these problems. We're super appreciative of your support. Look, you're already here. Hey, good to see you. We're bringing Diane Russell to talk to us a little bit about water resources and thinking about solving some of these problems that we see. And Diane, tell us a little bit about some of the resources we should be thinking about that sort of dovetail with what Faith has already talked to us about.
Yeah, I think it's a great combo. Faith has really covered a lot of what kind of real-time resources that community members have access to. For those of you who maybe don't know me, I work for the Environmental Protection Agency as a community involvement coordinator. I've had an office near the Kettering University campus since 2016. And we have worked over the years with community members on, some of the questions and concerns that they've had about water and facilitating resources and connections. And I think most recently, what is really, I've gotten a lot of questions about, and Faith and Lottie had kind of helped, highlight some of those resources that the City of Flint have when it comes to filters and accessing those. And so people are having questions again about how to use filters, how to install filters. So there's an education component to filters are not always intuitive. If you're not used to using those inline filters, or maybe there's some different things going on at the faucet level in your particular home, there's some steps that you'll need to take to, use those adapters, or even like as you have it installed, making sure it's installed properly, checking to see that the light, the indicator light on the filter itself is operational. I actually had to do this myself recently. I went into the to the office, and we had a a pure filter that we had on the faucet, and the light wasn't on, the light wasn't working. There is a lifespan to those. So in that case, it was time to that no longer worked, and we needed, I installed a new inline filter that, so the light would work. The light doesn't always stay on. It should blink when water is running through, either straight through or when it's in the bypass going through that filter. So I wanted to make sure, again, take this opportunity for everyone to have access to information that's still current. EPA had put out a simple reference guide that how to proper use of filters and steps you can take, making sure you don't run hot water through it, through the filter cartridge. It can impact it's how effective it is. So if you do find you're accidentally ran hot water through it, it's just a simple, just change the cartridge. But I have resources that, you don't have to remember me telling you this today. It's a lot of information. Again, like I said, using filters isn't always intuitive, but when used properly, they really do protect residents from any kind of lead that may be in the system, especially, and EPA has been consistent about talking to community members about this issue on as lead lines are being replaced. You can have construction is going on, and you could have a flake of lead that could get into the system and cause a temporary increase. And those filters are really good at capturing those pieces. So out of extreme caution, our advice to Flint residents is to continue using filters, especially as the lead line replacement program is going on. And if you have specific health concerns about using that or using another drinking water source that's available, folks have certainly used relied a lot on bottled water and also getting water from other sources like water boxes in community. So if you have specific concerns about you or even how you use water and medical devices, please, your healthcare provider, your primary care physician is going to be the best source of information on that, because they know your particular issue, or concerns that's relevant to you personally. So these recommendations are very broad and can cover, it's meant to cover most everyone, but understand that there are specific concerns that folks have on an individual basis.
You mentioned the filters. I was going to ask you, but can you talk a little bit about those water boxes, just for everyone who might not already have context? Like, what's the water box? What does that do? I've had the privilege of learning about it, but
yeah, so I know, and I think Faith has kind of been more of an education to me on this one but so I don't know if she has any more up-to-date information about them, but they are placed around the community. So these are machines that do inline filtration of water that people can go and take reusable containers and fill on the spot. So this has kind of filled a gap for folks who want to maybe not have to manage bottled water all the time, but maybe just refill a usable container. And these are located in places around the community. And Faith, I didn't know if I know there's an ongoing update to a list of where those locations are as far as these water boxes. And I don't know if you guys have gotten a chance to put that on your website yet or not.
Yeah, it's on the website under resources, under water. There is a website, waterbox.org. I'm not sure that's the most up-to-date list, but we did call all the locations that we knew about and put their information on our resource list. But we do recommend people to contact the locations just in case there's a change in schedule.
Wonderful resource for people. And the link is in the chat. Thank you, Heatherline. You mentioned, Diane, you were talking about different health concerns that people might, have and that they might take to their PCPs. What are you hearing people call and say, I'm worried about this? What concerns are coming to you, or what are concerns that you've heard?
people with pre-existing conditions, and there's been a lot of, folks who were concerned about bacteria in their drinking water. There's concerns people still have are still having reactions maybe to, I've heard anecdotally that folks are still having some skin irritations associated with water. As we've, looked at these issues and looked at the relation to, chlorine in the system, especially when talking about bacteria, chlorine is such an important solution to that problem. And not only in our drinking water system here in Flint, but in other municipalities as well. It is a key piece in the arsenal of providing clean drinking water and maintaining proper chlorine levels to make sure that bacteria is minimized is really important. So one of the things that we've talked about in the past is the importance of kind of running water in making sure that, especially if the water's been sitting for a minute, it's, because chlorine can dissipate over time. So when you start off the day and run water, it's always a good idea to run it till you get a nice cold, that, because sometimes it'll sit in the pipes overnight and maybe it comes out lukewarm, but then after a period of time it comes out cold. Then you're getting fresh water coming in from the line that has not been sitting. So that's a good practice to help maximize and maintain chlorine levels in your home. So flushing is a key solution to that. And I think another step that folks can take, especially using their filters, because there's concern about like how filters might build up bacteria over time. Flushing is not only a good thing for those filters, but so is proper maintenance and cleaning. Follow those manufacturer's instructions that come in the box when they talk about how you maintain your filter. Sometimes it requires some wipe downs and, certainly making sure that your cartridge is, when its life is over, we're changing those out and making sure that those lights are green and not yellow. Yellow means you got to start thinking about getting a new cartridge in there, and then red is you need to change it.
I was going to follow up.
I just wanted to make sure that, oh yes, thank you, Heather, for posting that we have, again, it's a nice handout to reference for folks about installing your filter and replacement cartridges. And then the second page is like proper good maintenance, not running hot water through it, and making sure that you're running cold water through the filter, and then checking those indicator lights, and encouraging folks to flush, especially when the lines have been sitting.
That makes sense. With the last minute that we have, I wondered if you could tell people, you mentioned talking to the community, and what are the avenues that sort of community is able to share some of their concerns with you, so that we can make sure that, they're able to reach you appropriately. I know you've talked a little bit about being at some city calls and webinars like this and things like that. And so I imagine we would love to hear kind of what are the best ways to reach you.
I did a little back of the envelope calculation over the month of January, and I think I have managed to, I'm sure there's some crossover on that, but conservatively around interface with about 200 people over the month of January, just being places, just showing up and being present and listening to what community at various types of meetings. I'll actually be at the Flint Neighborhood United meeting tomorrow, in case anyone's around. Love to talk to you and hear what your perspective is. But I'm gonna offer my email address at russell.diane@epa.gov. And if you have concerns, so I'm happy to meet with anyone or talk to anyone individually. But I would also encourage folks, if they have concerns about their water, they're experiencing problems, to make sure that the first step that you take is to call the city. There's a hotline that you call that's on the city's website. If you have water issues, call that number. And first and foremost, if there's it still continues to be unresolved. We do have a reporting hotline through I'm trying to see if I have it on my tabs open already. But it's the to call to report a violation at EPA. But it's important, if you go to that stage, you're not getting your issue addressed. It's important to document the steps that you've taken first and foremost, because we're going to be working very closely with the city to resolve any issues that might come up.
That is super helpful information. And thank you so much. All right. I want to say thank you to all of our wonderful guests. I know Lee Pierce will be here again, so don't hesitate to bring us your questions next time. Remember, it is Heart Health Month. Wear red. February is American Heart Month. Thank you so much. And I'd be remiss if I did not remind you that it is Black History Month. My daughter would yell at me. She's already given me homework. Thank you so much for all of your attention and time and expertise. Thank you to our partners, and a reminder about those continuing education credits. Thank you. See you next time.